Doctors thought a California man had COVID-19, but it was actually murine typhus. Here's what to know when a 25-year-old man from Southern California experienced headaches, fever, chills, and muscle pain in July. The first thing his doctor did was test him for COVID-19. Eventually, after another negative COVID-19 test and almost 3 weeks of symptoms, he was diagnosed with murine typhus, a flea-borne illness. According to a case report published in BMJ Case Reports on November 3rd, the man was febrile, showing a fever with a temperature of 38.4 degrees Celsius when he first attended the emergency department. His vital signs were stable and his physical exam was normal. So he was treated with oral ibuprofen and discharged with a diagnosis of presumptive viral syndrome. A few days later, the man reported persistent fevers, cough, body aches, and vomiting during a follow-up with his doctor on the telephone. He also had new back pain, and his temperature had reached a high of 39.9 degrees Celsius. At this point, he was advised to attend urgent care, and by the time he got there he had a pulse rate of 125 BPM. A normal resting pulse rate for an adult is 60 to 100 BPM. For Cleveland Clinic and slightly lower temperature, he was treated with antibiotic and pain relief meds and discharged with azithromycin, an antibiotic used to treat a number of bacterial infections. But he continued to experience daily persistent fevers as well as cough, chills, body aches, headache, dizziness, fatigue, and diarrhea. On day 14 of his illness, during another telephone consultation with his doctor, he revealed that he was a dog trainer. It was at this point that he was tested for murine typhus, a disease transmitted by fleas, and everything fell into place. Flea-borne murine typhus is caused by a bacteria called Rickettsia typhi and spread to people through contact with infected fleas, says the Centers for Disease Control and Prevention, CDC. Here's how it happens. Fleas get infected when they bite infected animals. They poop as they feed. And infection occurs when flea feces, also called flea dirt containing the disease agent, is rubbed into the bite site or other skin wound, breathed into the airway, or rubbed into the eye. Murine typhus is a rare disease in the U.S., but cases have been reported in Southern California, Hawaii, and Texas. It's not the same as epidemic or louse-borne typhus, which doesn't tend to occur in the U.S. According to the Los Angeles Department of Health Services, the Norway rat, roof rat, domestic cat, and a possum are typically involved in the transmission of murine typhus to people in Los Angeles County. Dogs can transmit the disease to humans too, per the case report. Symptoms of murine typhus usually present within 2 weeks after contact with infected fleas or flea dirt, says the CDC. But as the case report shows, it's essential to tell your doctor if you've had any potential contact with fleas, or else you may be misdiagnosed. The following signs and symptoms are related to murine typhus, per the CDC. Fever and chills, body aches and muscle pain, loss of appetite, nausea, vomiting, stomach pain, cough, rash typically occurs around day 5 of illness. However, it's possible that if left untreated, murine typhus can cause damage to one or more organs, including the heart, kidney, lungs, liver, and brain. Because the symptoms of murine typhus can be nonspecific, it can be challenging to diagnose in a timely manner, wrote Mahesh Patel, the author of the case report. This is especially true during the current COVID-19 pandemic, where the non-specific presenting symptoms of murine typhus, fever, headache, and myalgia overlap with symptoms of COVID-19. Dr. Patel noted that fever is reported in more than 90% of patients with murine typhus and 83% to 98% of patients with COVID-19, which may blind the clinician from exploring the broader differential diagnoses of other febrile illness. But unlike COVID-19, which is mainly transmitted via close contact between humans, Murine typhus can be spread from person to person only via contact with infected fleas, which is why it's so important to tell your healthcare provider if you've been in contact with animals. Another big difference between murine typhus and COVID-19 is that murine typhus is completely treatable with antibiotics, such as doxycycline. To date, there's no approved treatment or vaccine for mild COVID-19 infections. Recently, CDC approved remdesivir for treatment of cases of COVID-19 that require hospitalization. Once the California was given his proper diagnosis of murine typhus, he was treated with doxycycline twice a day for 2 weeks, after which his symptoms resolved.